Hi, I'm Christina. I'm a physician assistant student. Could I ask you about you in today?
I came in today because I've just been having this really tight chest for about 3 days.
I'm sorry to hear that. Did you notice anything that was going on when this chest pain started?
Well, it happened when I was exercising, but then it also happens when I'm near my dog. So I don't know. It's kind of random.
So being near your dog makes it worse. Does anything make it better?
I tried cold stuff, and that didn't help at all. Cold medicine.
Okay. If you could rate the pain on a scale of 1 to 10, how bad would you say?
So it's not necessarily painful, but I guess it in terms of being annoying. It's a 4, but it's just constant.
Do you have any other words other than tight to describe the pain?
Not necessarily. It's just tight and then it's difficult to breathe.
I'm sorry that's happening.
Thanks. It's pretty rough.
Is it always difficult to breathe? Does that come and go, or is that constant also?
I mean, for the most part, it's pretty constant, but it gets a lot worse when I try and exercise.
Does it get better when you do anything, when you rest?
I mean, I guess if I'm exercising and I stop, then it gets a little bit easier to breathe, but it's still tight, and there's occasional pain.
Has it gotten any progressively worse? Did it get better at all since it started 3 days ago?
It stayed the same.
Does it radiate anywhere else?
No, it's mainly just in my chest.
Okay. Okay. Do you have any other symptoms? Is it radiate to your nose, throat?
Sometimes I have some wheezing sounds. It's a little weird. And I hack up mucus sometimes. But other than that, that's basically it.
Okay. So do you cough a lot with this?
Yeah.
And you said you do cough up sputum?
Mm-hmm.
Could you explain that? Is it colored? Is it runny, thick?
It's kind of clear. It's not super thick. I think it's mainly just snot. It didn't seem like it was green or had any color to it.
Okay. You have shortness of breath and wheezing. Is it painful when you take a deep breath?
Sometimes, yeah.
Do you have any history of asthma or asthma in your family?
I don't think so.
Any bronchitis history?
I had it 3 years ago, but...
Any emphysema history, pneumonia?
No.
Or tuberculosis?
No.
Okay. So you said you had bronchitis 3 years ago?
Mm-hmm.
Was that similar to this feeling?
Kind of, but that one had a lot more mucus, and it was gross mucus. It was green, and I was hacking up a lot more than I would with this cough.
Yeah. Okay, so overall, has this ever happened before?
Not really. Actually, just kidding. I had some similar symptoms when I was a kid, but then they just kind of stopped, and now it's back again, which is weird.
Did they do anything for the symptoms when you were a kid? Did you go to the doctor?
I didn't go to the doctor for it. Yeah, my parents
just
thought that it would go away on its own.
Okay. Have you noticed any heart trouble?
No.
Do you have any high blood pressure?
No.
Any heart murmurs?
Nope.
Any rheumatic fever history?
No.
You said you have chest discomfort.
Right.
Have you noticed any palpitations
No.
or shortness of breath?
No.
And do you need to use pillows to ease breathing at night?
No.
And do you have any swelling in your hands, your feet?
No.
No. Okay. Do you have any allergies that you know of? Medications, environmental?
I can't take penicillin.
Did something occur when you took penicillin?
Yeah, I had an infection one time and I got like a rash all over my body, so that was not fun.
No, that's not good. Any other allergies that you know of?
No.
Are you on any medications?
Yeah, I take a multivitamin every day, just in the morning, and I'm a diabetic, so I just have insulin 3 times a day before each meal.
Okay. How long were you, oh my goodness, when were you diagnosed with diabetes?
I was diagnosed 13 years ago as a child, type 1.
Could you describe your childhood health overall to me?
For the most part, I was fine. I mean, my parents realized I had diabetes after a couple of hospital stays, nothing major. I had that bronchitis, and I had these like weird symptoms before, but I mean, other than that, I think it was a good childhood.
Did you have any history with measles,
No,
rubella,
no,
mumps,
no,
whooping cough,
no,
chicken pox?
no,
You said no to rheumatic fever, scarlet fever,
no,
polio,
no,
diphtheria,
no,
and any psychiatric disorders?
no.
Okay. Did you get all of your immunizations that you?
I think so. My mom was pretty religious about taking me to my pediatrician.
So you had the polio,
Yeah,
MMR,
I think so.
tetanus,
Yeah,
diphtheria,
yeah.
rotavirus,
Yep.
hepatitis B,
Yeah.
chicken pox,
Mhm.
and pneumococcal.
Mhm.
And your adult health, how has that been?
Pretty good, other than this nagging difficulty of breathing.
Okay, good. Do you have any history with thyroid disease,
No.
heart disease,
No.
hypertension,
No.
hyperlipidemia,
No.
COPD or asthma,
No, I don't think so.
any cancers,
No.
HIV,
No.
hepatitis,
No.
kidney disease,
No.
blood clots,
No.
and any psychiatric history?
No.
Okay. And have you been getting your flu shots?
Yeah.
Yes. Did you get the Hep B booster,
I think so, yeah.
the zoster,
Mhm.
and the pneumococcal?
Yeah.
So you had bronchitis. Do you remember how your bronchitis was treated?
Pretty sure he took amoxicillin. It's that pink bubblegum stuff.
Yes. And any complications from that?
No, it went away. Thank God.
Any other medical illnesses other than the diabetes and bronchitis that you could think of?
No.
Okay. Any accidents or injuries?
Let me think. I did separate my shoulder during a football game.
Do you remember what year that was in?
I think 2000, if I had to say.
That sounds painful.
Yeah, it was alright. It was just in a sling for a couple weeks.
Sling. Did you go to the hospital or anything for that?
Yeah.
And then it healed up okay?
Mhm.
Any other accidents or injuries?
I think so.
Any hospitalizations?
Not that I remember.
Okay. Any surgeries?
I had my wisdom teeth removed. if that counts.
Yes. When did you have those taken out?
5 years ago?
Do you remember who performed the surgery?
I have no idea, sorry.
It's okay. And did that heal up okay?
Yeah, that was good, yeah.
Any other surgeries?
I don't think so.
Okay. Now I'm just going to ask you a few questions about your health maintenance.
Okay.
Have you ever been screened for cholesterol? For your cholesterol
I don't
levels?
think so,
For tuberculosis?
no.
Any screenings for lung cancer?
No.
You would not have had your colonoscopy yet? Okay. Have you ever had your prostate examined?
No, not yet.
Okay, I didn't think so. That's when you're older.
Right.
Okay. Okay, I'm just going to ask you a few questions about your sexual health. Are you currently sexually active?
No.
Okay. Have you been recently sexually active?
No.
No. Okay.
I have a abstinence pact.
Oh, you do?
I'm pretty religious.
Okay. What does that mean to you?
So I came up with it with my pastor. It's just refraining from any sexual activity with anybody until I'm married.
Okay. So at your home, who do you live with?
My parents.
Your parents.
Yeah.
Do you feel safe at home?
Mm-hmm.
Do you feel respected by everyone, your peers?
Yeah.
Good. And have you had any psychiatric history?
No.
Okay, I'm just going to ask you a few questions about your family history.
Okay.
So this includes your grandparents, your parents, and yourself, and any siblings that you have.
Okay.
So do you have any family history of headaches,
No.
a seizure disorder,
No.
stroke,
No.
mental illness?
Yeah, my dad suffers from depression.
Okay. That must be hard for him to deal with.
Yeah. It's managed now with medications. That's all good.
That's good. Any family history of suicide,
No.
substance abuse,
No.
thyroid disease,
No.
coronary artery disease,
No.
hypertension,
No.
hyperlipidemia,
No.
diabetes?
My grandfather has it, yeah.
Is that on your mother's
Mom's
side?
side.
Okay. Any family history of asthma,
No.
tuberculosis,
No.
renal disease,
No.
arthritis,
No.
allergies, cancer, and any genetically transmitted disease?
I don't think so.
Okay. Do you know by any chance what type of diabetes your grandfather has?
I think it's type 1 too.
Type 1.
Also, now that I think about it, my uncle on my dad's side, I think he was diagnosed with asthma.
Asthma.
Forgot about him. We don't really talk to him that much.
Yeah, it's good to note that though. Is there any other family members that you can think of with any other significant health?
I don't think so.
Okay. I'm just gonna go in through your social history.
Okay.
Where were you born?
I was born in Downingtown, PA.
Okay. I forgot to ask this earlier. What is your birth date?
It is July 20th, 7/20, 1996.
1996. Okay. How was your perception of your childhood?
I think it was good.
Good. What is the last year of schooling that you've completed?
I'm currently in college, so I'm a senior in college.
And where do you go?
I go to Philadelphia University. you heard of it?
I have actually.
Oh, cool.
It's close by.
Oh, yeah, yeah.
Do you have any occupational history? Do you work while you're in school at all?
I worked as an EMT, but I don't do that anymore.
You said you live at home with your parents?
Mm-hmm.
Do you have any current sources of stress that you notice?
I mean, other than school.
School. Have you had any previous sources of stress that really stand out?
Not really.
Okay. Any military history?
No.
And how would you describe your financial situation? Do you find that it puts a lot of stress on you at all, or?
I mean, it's stressful at times, but I think we're managing well.
Okay, that's good. And what are some of your leisure activities?
I like to go for hikes with my dog. Actually just got him like
What
a
kind
month
did you
ago.
get? Or what kind is he?
I got a golden retriever.
Oh no.
So,
Oh my gosh,
just a
those are so
classic.
cute.
Yeah, yeah, he's really cute.
If you had to describe how well you can, you like live on your own, you with bathing, dressing, going to the bathroom, that kind of stuff, can you do that pretty much on your own?
Yeah, definitely.
Okay. And do you have anyone helping you, cooking, cleaning the house, like making meals, managing your medications?
No,
No,
I
okay.
basically did it on my own.
Do you have any religious or spiritual beliefs?
Yeah, I'm Catholic.
Catholic. Do you currently go to church? Are you?
Not as much as I should. I usually go about twice a month.
And how often do you exercise?
About 4 times a week.
It's very good.
Gotta stay on the grind.
What kind of exercise do you like to do? Do you like to run, lift weights?
Yeah, I like to do a mixture of both.
Mixture. Okay. And what's your diet like? What kind of foods do you like to eat? Do you have a lot of caffeine?
I mean, I have a cup of coffee every morning, maybe one at night after dinner. Try and eat like well-balanced breakfast, lunch, and dinner. Never skip a meal.
That's good.
Try and drink water throughout the day.
Do you find yourself eating out a lot, going to fast food?
Nah, I'm pretty cheap, so I don't like to spend too much money.
Yeah. What are your sleep habits like?
Sleep's really important to me. I think I get a solid 7 to 8 hours every single night.
That's very good. It's hard to do that too when you're in school.
Yeah.
Okay. These questions might seem a little bit weird, but I just want to check like your overall safety.
Okay.
So do you always wear a seatbelt when you're in the car?
Yeah.
If you ride a bike, do you normally wear your helmet?
Sometimes. Don't want to mess up the hair.
Right. Do you wear sunblock?
Yeah.
Good. And do you have smoke detectors in the house?
Yep.
Do you have locked cabinets for medicines at all?
No, we don't really have any kids in the
Okay.
family. So.
Good. Do you have any firearms at home?
No.
Okay. And do you have any alternative healthcare practices?
I don't think so. No. Everything's pretty standard.
Have you ever used any tobacco products?
Yeah.
What kinds?
I currently smoke cigarettes.
How many cigarettes would you say that you smoke a day?
About half a pack a day.
And how long have you been smoking?
For 2 years.
Have you noticed that you've been smoking increased amounts of cigarettes a day, or is it pretty much been the same?
It's been the same.
Okay. Have you ever thought about quitting smoking?
Yeah, I've thought about it a couple times. My mom doesn't really like it.
Yeah.
But I've never actually made a plan.
Is there anything that's holding you back from stopping?
Not necessarily. It's just with school, like it's just one other thing that I have to worry about.
Right. So it's like a kind of like source of relief.
Yeah, kind of gives me a break.
Have you ever thought about investigating other ways that you can quit, but maybe it'll still be like a relief for you? Like you can have types of nicotine patches or the
Yeah, I've
gum.
seen those commercials, but I've never actually tried it.
Would you be willing to try it?
I think so, yeah.
Okay, that's good. I think that would be important. It might help your overall health if you notice that the shortness of breath is occurring like without these other symptoms. It might help that.
Okay.
Do you typically drink alcohol?
Only on the weekends, really.
How many drinks would you say you have on the weekends?
Maybe 4.
What's a typical drink to you? What size? What kind of alcohol?
I guess like 8 ounces, maybe like a mixed drink.
Mixed drink. Do you use any drugs that are illicit drugs? Any drugs that are not prescribed to you?
No.
That's good. Okay. Now, the next part's going to be a lot of yes/no questions. I'm just going to go over your overall health and everything. So, have you noticed any recent weight change?
No.
And are your clothes fitting differently, looser, tighter? Any overall weakness, fatigue, and any fever?
No.
Have you noticed any rashes on your skin?
No.
Any lumps?
No.
Any sores? Itching? Dryness? Any change in your overall color?
No. I'm getting paler though.
Getting paler?
Yeah. I think it's just because I'm not outside as much.
Oh, yeah. It's getting to be fall.
Right.
It is sunny.
Yes.
Any change in your hair or nails?
No.
Change in any size or color of moles that you have?
No. I don't think so.
Good. Have you noticed any increase in headaches recently? Any head injuries?
No.
Dizziness?
I get a little dizzy, like if I'm coughing a lot.
Okay. And any lightheadedness?
I don't know. I guess it's kind of it's the same thing with coughing a lot. Yeah.
Okay. Do you wear any glasses or contacts?
Yeah, I wear contacts and glasses.
Okay. Do you wear them all the time?
Yeah, I wear my contacts all the time and sometimes my glasses.
Okay. Are you good at changing your contacts?
I have monthlies.
Okay, good. How would you describe your overall vision? Has it changed at all recently?
No, it's pretty steady.
When was your last eye exam?
I think about a year ago.
Okay. Do you have any pain in the eyes? Any redness? Any excessive tearing?
No.
Double or blurred vision?
No.
Do you see any spots, specks,
No.
flashing lights?
No.
Do you have a family history of glaucoma
No.
or cataracts?
No.
How would you describe your hearing?
Pretty good, yeah.
Good. Have you noticed any tinnitus, which is like ringing in the ears?
No.
Any vertigo?
No.
Any earaches?
No.
Recent infections?
No.
Any discharge? And do you use hearing aids?
No.
Okay. Do you get frequent colds, like nose, sinus infections?
No.
Any stuffiness? Discharge? Itching?
No.
Any history of hay fever?
No, I don't think so.
Okay. Do you have frequent nosebleeds? And any sinus trouble in general? Okay. Do your gums bleed a lot?
When I floss, but not like on the regular.
Yeah. Do you wear dentures?
No.
Okay. And when was your last dental exam?
6 months ago.
Good. Do you have a sore tongue?
No.
Or it's a weird question, but we got to make sure that everything's okay.
Right, of course. I'm glad you're thorough.
Any dry mouth?
No.
Any frequent sore throats? And any hoarseness?
25.